I think we're good.
Okay.
Make sure everything else is muted and it'll be all right. Is my you're not getting any feedback or anything from my headphones?
No.
Okay, cool. All right, yeah. So I know we got to wrap this up. Trying to think. So only other two things I'd really like to talk about due to time constriction is, oh man, I got so many good questions. That's hard because we were talking about the meridians, the energy pathways from Dr. Nunnally and the breast cancer relationship, or you want to talk about stem cells because those seem to be in vogue right now. Everybody's doing stem cells, and um, or we could talk about something as simple as people using a water pick versus flossing because that's something everybody can do. It's both of them are cheap.
Okay, so we'll touch real quick. We'll touch on all those things really quick. If not, I'm happy to do another time, and we can add some questions now that we maybe have this Google Hangout thing figured out.
Awesome. Sounds wonderful. Thank you.
Okay, so real quick, I'll finish up on that breast cancer thing with the meridians. I don't know how much got cut off, but there are some studies, and they've been around for a while, and they continue to come up where women that have specifically a root canal on specific teeth, which is usually a premolar, an upper premolar, which would not be your molars, your two big teeth, but the teeth in front of that. Although I have seen it associated with some molars as well on the upper, with that being associated with a higher incidence of breast cancer on that same side. Now, it does not mean that every lady who has a root canal is going to develop breast cancer, but it does mean that according to studies, you may have a higher risk of that. So I would definitely as a female, be very aware of that. I have taken out many a root canal tooth on females that either have had a diagnosis of breast cancer or are in remission and want to take away any chance that they could go back into an active stage of cancer. I am having, we here at our practice are having more and more oncologists, interestingly enough, that are very open to the idea that they as they're helping their patients fight cancer, whether in a conventional or an alternative way, they don't want anything else in the body. They really are picking up on that idea that there could be something else in the body that's a drain or a challenge to the immune system. So with that being said, yes, there are some studies with breast cancer lining up with those meridians with the root canal. Okay, so we talked a little bit about meridians. Just if you pull up, you could Google meridian tooth chart. And find an easy one to read. There's a bazillion ones that'll come up under images on Google, but meridian tooth chart. And basically what it's following is our acupuncture lines that are recognized more in Eastern medicine, but that really are vital for us to understand how the body is connected. It shows you how the teeth are connected, which individual teeth are connected to muscle groups and organs and different parts of the body, so that when we're tying things together, you can see how God kind of lined everything up. So there's that. And then as far as, I think I'm missing one question, but we can go back to it. As far as with periodontal disease, with using a water pick or floss, the reason that we think and that we see, I shouldn't say just think, that a water pick is more effective is because you can do a great job at flossing. Flossing can definitely clean between the teeth, but what it can't do is really flush things out between the teeth, but more specifically along the gum line. And that's where bacteria love to kind of get down there and congregate, is below the gum line where your toothbrush really can't get. And studies show that just simple swishing some type of mouthwash in your mouth is only about 20% of it is going to get under the gum line. So it's not very effective to just swish with a mouth rinse, no matter how great it is, or to floss. A water pick actually sends that little stream of water mixed with, a lot of times we recommend a dilute solution of hydrogen peroxide or apple cider vinegar. I have some patients that use iodine. I have some that use colloidal silver in their water pick as dilute solutions. But it flushes below the gum line and it's washing those bacteria out of there on a daily basis. So you can floss also, but the water pick just tends to be more effective under the gum line. Did I get them?
Okay, cool. No, yeah, that's great. I had a question that entered my mind and then slipped out when you're talking about the water pick and the floss. Goodness. I don't even know what it was. Hopefully it'll come back to me because I really feel like it's a good question. It went right on in line with what we were talking about. Um, what about implants? That wasn't the question, but
Okay.
because I know a lot of people they don't have the teeth or they want to get something in place of an extracted tooth, or you have elderly people that have dentures, or
Mhm.
a perfect example is my friend next door. He got into a major car accident and he broke what he lost like half of his teeth on his bottom jaw. So
Oh
he's
gosh.
going to get implants because he's 26 years old, and he told me he wants to get implants because he doesn't want to have a bunch of missing teeth.
Yeah,
How
absolutely.
does that interfere? Because you're putting in a foreign object to your body, and it's going to recognize it as a foreign object, especially if it's titanium or whatever,
Mhm.
zirconia. I don't know, but
Yeah. So
your thoughts?
implants, yeah, implants just real briefly, because you could have a whole session on implants. Implants, for anyone who doesn't know exactly what that is, would be if you've lost a tooth and you want to replace it. Um, an implant basically looks like a screw. It's either a titanium, which would be a metal type of screw, or a zirconia, which would be more like a non-metal ceramic type of screw. And those are actually the way we put them in is by making an access in the bone once an area heals, and then they literally are screwed in because we want the body to integrate in between all those little tines. And so they're a great concept as far as replacing teeth because they allow you to put teeth. If you can't hang a partial or a bridge on other teeth, or you don't want to, this lets you have a standalone tooth. So it's a great concept. The problem is that just as you pointed out, it is something foreign. So for some people that have a really healthy, robust immune system, that's not going to be an issue. But for someone whose immune system is really fragile, I would never recommend that at that time unless their immune system makes a recovery, because we're asking your body to respond to something foreign that's not only just maybe sitting on a tooth like a crown would be, but it's actually implanted in the bone. And then, so that's kind of an individual assessment. If your friend is young and healthy, that's probably going to be a great option for him. Now, the difference between the titanium and the zirconia is really basically materials. I have a lot of patients who, over the last 17 years of my practice, I've sent for them to have implants. And for a long time, our only real option in the United States was a titanium implant, because there are a lot of research behind them. And I think overall, titanium implants can be a really good option. The problem is I have so many patients who have a metal sensitivity or who are concerned about metals. And so we were really excited when about 10 years ago, the FDA did approve a zirconia implant. Europe is always ahead of us on testing, so they've been using these for 25 years in Europe. But we finally had a system in the United States, and it's been a great system. And now some of the bigger companies are picking up on this biological trend of people that don't want metal, which is great for us because that means we've got some big companies behind creating and doing more research on non-metal implants. So what we're seeing is that those non-metal implants, those zirconia implants, are considered much more biocompatible. The tissue loves them. We don't see the same type of kind of aggravation around the tissue that we would sometimes see with titanium implants. And for a patient that is concerned about metals, it's a really great option. But you just have to remember that it's not for everybody based on your specific immune system. So, and then
Right.
there's a whole nother part that you can get into that's a big branch of discussion with functional medicine doctors and other people that are looking at those meridians as to whether this foreign object can actually block the flow of information and electricity through that meridian because it's not a living thing. So we go back and forth a lot with patients on that, mainly deferring to whatever doctor they're working with that knows their system so well as to if this is going to be a good choice for them.
Okay. Yeah. Awesome answer. And Jesse, that was my friend that kind of came from him about the implants. One last thing, and then we can wind it up. And there was the question that came back to me when you're talking about swishing and flossing, oil pulling. I know coconut oil pulling is a really big thing too. And I've heard from Dr. Curatola that he is okay with it, but he kind of frowns upon it because he looks at it as a detergent. I know he's got his own product called Revitin that I haven't really looked into or not, but what's your thoughts on oil pulling, say maybe every other day or even
I
every day for people?
Yeah, I think oil pulling is great as an overall detoxer. It's probably not gonna, if you've got some active periodontal disease and that bacteria is in these pockets that are 4 and 5 millimeters under the gum tissue, the oil pulling is definitely gonna help you overall, but it's not gonna get rid of your periodontal disease. So when you're thinking about oil pulling, you need to think about that as an overall health benefit as far as a detoxifier. I'm not familiar with Dr. Curtola's product, and it may be a great product with some added benefits, but coconut oil is very well accepted as a great agent for the for oil pulling. And so I have a lot of patients that do it and have really feel like it benefits them a lot. Of course, I've also had some patients do it and they didn't feel like they had a lot of change, but it may have been that they just had too much of a burden in other parts of their body to really see that change. So as an overall detoxifier, I think it's a good thing. And it's really based on individual as far as whether you do it once a week or once a day or somewhere in between.
Okay, excellent. I know I had my wife and I did this thermo body scan with this functional doctor up in Dallas, and she had showed us results from patients who had actually just the only thing they changed differently from going to their practice and getting holistic dental care was they did oil pulling every day, and it showed like I guess an increase or rise in their immune system going back up, whereas before it was kind of hindered or compromised, if you will, in a way. But it showed overall improvement of their health on different levels from this device that she had, which I don't know if you're familiar with that or not, but that's whenever I first got interested.
Yeah, I see a lot of thermoscans, and we look at them a lot with other doctors in concert with what they're seeing from their end and what we're seeing from a dental standpoint on X-rays and on a visual exam. So we do see those thermoscans a lot.
Okay, yeah, they were really cool device. I had never heard of one. They looked really expensive, and I was like, okay, yeah, sure, we'll try it. It's pretty interesting. All that stuff was new to us, and it just opened up my eyes to a whole new world. But I know you got to run, and thank you once again for coming on here. It's awesome conversation, and yeah, I could talk for hours until end. So
Absolutely.
thank you so much.
If you come up with another list of questions, I'm happy to do this again, and we may go a little more smoothly next time now that I know how to connect on this.
Yeah, hopefully the internet connectivity will be in our favor as well. But are there any other topics that you're super passionate about outside of oral health and mercury toxicity, like cancer or anything? Or
this is kind of what I do every day. I love my job. I don't even really think of it as a job, but I love my conversations with patients because everybody's case is different. And so we get to really look at what they have going on medically and dental wise and put that all together like a puzzle. So I feel very blessed to get to do that. So I think my passion is more just about educating patients so that as they are looking, there's so many smart functional medicine doctors out there and so many researchers who are just uncovering so much for us. And so if I can just kind of bridge that gap, that's really what I enjoy doing. So, yeah.
That's awesome. I can tell you that you have started a ripple effect, and I hope to compound on that to create a lasting impact into other people to bring an awareness and education to change lives. I feel like that's what we're here for. I mean, you're the expert, you're the doctor. I'm not. I'm just a layperson, but hopefully I can take all these conversations and break it down for people to understand and help them better too. And I think you did a wonderful job at that. And one last thing, what book or books has inspired or changed you the most, and what book is something that you always recommend for people to read?
Okay, so a couple of books. Hal Huggins wrote some good books that really help people put a finger. I haven't read them in a few years because there's always so much else. But it's All in Your Head by Hal Huggins, who is now deceased. But that really helped people say, oh, it is technically in my head, but I'm not imagining this. So that's a good book. Anything by Thomas Levy, his most recent Hidden Epidemic is just
phenomenal.
It's phenomenal, and it's filled with so much research. It's backed up by not only all of his knowledge, but so much research. So anything he's written about toxicity of root canals, vitamin C, the benefits of all of that, anything there. There's also some websites and things like Truth About Cancer. Dr. Nunley has spoken at their conferences and things like that. There's just a wealth of knowledge out there when you're looking. So I would think those are, I'm trying to think of what's in our bookshelf here at the office that we hand out to patients. And those are probably, not Root Cause, that's the movie. Roots of Disease. That's that's another Levy book. So a lot of those are what's in our bookshelf here. So if a patient has a question, we're not trying to talk them into something. We're like, research for yourself. Here's something to get you started, so you kind of know what you're looking for. And that's where I'd start.
I remember whenever I came out of y'all's office, I told my wife, I was like, "You wouldn't believe the books they have. They're incredible. Like, I love these. I need some of those on my own shelf." I really liked it. What about one book that's personally changed your life?
Besides the Bible.
That's a great one.
So I think, well, probably because that was one of the first, Hal Huggins' book, It's All in Your Head, was probably one of the first books I read as we developed this. And so personally life-changing, that would definitely be the top of my list as far as that's concerned. There's definitely some others that I've read that have impacted me, but I think that would probably have the most impact on how it shaped my practice. Absolutely.
That's awesome. Well, thank you so much for the information, and I most certainly enjoyed the conversation. So thank you so much for coming on, and I'm looking forward to doing it again next time. Thank you.
All right, Chris.
Oh, one last thing. Let people know where they can find you, and if they want to know more information.
Okay, best thing to do is go to our website, which is healthysmilesforlife.com. It's no abbreviations. It's just healthysmilesforlife.com. And you can get all sorts of information there. There's a lot of YouTube videos that you can connect to there where we explain what we do and why. And there's also links. There's a link for the IAOMT on there, and just a lot of good information about the water pick, oral hygiene, things like that.
Awesome. Well, as always, Dr. Freeman, thank you so much. You have a blessed night.
All right, absolutely. Tell Amanda hi.
I sure will. Thank you.
Bye-bye.
Bye.